Hello, my name's Cameron Warriner. I'm going to be doing my NG video. So, got a doctor's order here for a nasogastric tube for patient Mr. Templeton. Knock, knock, knock. Washing my hands. Afternoon. Hi, my name's Cameron. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Okay, so it has been a few days, and that's because we were
John Templeton. Perfect. All right, John. The reason that I'm here, I know you've been feeling a little nausea, a little bit of vomiting lately. Doctor did a couple tests, and it turns out that you have a bowel obstruction. Doctor has ordered a nasogastric tube. So all that is basically it's a tube that's going to go through your nose, down your throat, and into your stomach. The reason for it is to go ahead and take out the gastric contents, thus alleviating some of the nausea that you're feeling right now. Is this going to be okay for me to be doing this procedure? Okay, perfect. So before I go ahead and do this, I need to ask you a few questions. Have you had any recent skull fractures or any recent head trauma injuries? Okay. Have you had any esophageal varices in the past? Okay. How about cirrhosis of the liver? No? Okay, perfect. Well, you passed my test initially. I'm going to go ahead and get some supplies. I'll be back. I'm going to do a full assessment on you, and then we'll go ahead and go from there. So, washing my hands, providing privacy, going out. I've gathered all my supplies, so I'm back with my supplies. I got a basin tube to go ahead and squirt the gastric contents out into, a baster to go ahead and collect the gastric contents, pH strips. I've got some water to go ahead and help the client drink the tube down. Some lube to go ahead and help ease the tube down the throat. Kidney basin, this was just kind of to collect all my supplies and bring them in. Tape, which I've already got out and ripped up into pieces for us. Neck napkin to go ahead and clean up any tubes, and then a 14 French nasogastric tube. All right, so knock, knock, knock. I'm back. Hello. I'm washing my hands, providing privacy. Hi. Can you tell me your name and date of birth one more time for me? Awesome. You're still John Templeton. Perfect. Well, I'm back with the supplies. We're going to go ahead and get going on this nasogastric procedure. But before I begin, I want to go ahead and do a quick assessment on you. I'm going to listen to your bowel sounds really quick for a minute in each one of the quadrants. 1 minute. 1 minute. Not hearing anything. 1 minute. Still not hearing anything. That's to be expected. You do have a bowel obstruction. So I'm going to ask you some personal questions really quick. When was the last time you had a bowel movement? A long time ago? Okay. What about last time you passed gas? Not for a while. Okay, that's okay. That's to be expected. Are you feeling nausea or feeling like you're going to vomit right now? How about hungry? Are you hungry at all right now?
Okay, so you're begging.
Okay. Okay. Well, I'm going to go ahead and now take a quick peek in your nose. I got a light here. I'm just going to go ahead and shine it up. So bright light.
Okay, go ahead, take a drink.
Shine in your nose. It looks like you don't have any polyps or any obstructions in the nose. Do you have any history of deviated septum, nasal polyps, cleft palate? Nothing? Okay. Well, we're going to go ahead and have you go ahead and plug one of your nose and breathe through the other one. So patients plug in their nose and just breathe through it, checking to make sure that the nostrils are patent. Okay, and you breathe. Go ahead and do it with the other one. Okay, perfect. So everything looks great. We're going to go ahead and get going with the procedure now, okay? All right. So I'm washing my hands. I've already moved the bed up to a high Fowler's position, so he's sitting between 45 and 90 degrees. I'm going to go ahead and wash my hands, put some gloves on. Okay. So, first things first, I'm going to go ahead and get my neck napkin, and I'm going to place it on the patient. That way, if anything leaks out while we're doing this, it's going to go ahead and collect on the napkin and not on his nice gown. All right, so next things next, you go ahead and get this straw open up. Get that going into the water. I'm going to go ahead and open up the nasogastric tube. Okay, good. Now, before I do anything else actually. I'm going to go ahead and bring the tube over here, and we're just going to measure it out just that way we can go ahead and, I already ripped my tape open, so I've got that ready for me. We're going to go ahead and measure the tube. I guess I'll do it so you can see on your side. Tip of the nose, bottom of the earlobe, and then down to the xiphoid process. Right down to about there. So that's where we're going to go ahead and mark the tube. That's how far we're going to insert it. That way we're actually in the stomach. Now this is a temporary piece of tape, so I'm not going to tape it too tough. That way I can actually get it off later on. So now I'm going to bring the tube back over to here. Lube onto this paper towel that I brought. Okay. Now I'll take the tip of the tube and just get the lube on the tip of the tube. Okay. Alrighty. So here we go. I'm going to go ahead and have the patient, they're starting with their head rested back. I'm going to go ahead and insert the tube about 4 inches. It'll probably make you gag. At that point in time, I'm going to kind of pull it out a little bit, have you move your head forward. Somebody will come in and bring a drink of water for you, or I'll grab the glass of water, and then you're going to help me by swallowing the water, and we'll insert the tube the rest of the way, okay? So, right here for you, we're going to go in. Okay, if he's gagging a little bit, go ahead and pull that out. This is when I would have probably another nurse come in and help me at this point in time, but he would go ahead and drink the water. Head forward, swallow, swallow, and then I go ahead and rest your head back again. Swallow. And we would go ahead and keep inserting the tube until we're up to the point that we marked it off, that it would be in the stomach. Okay, so we're all the way in there. I'm going to go ahead and first things first, we're going to go ahead and take a temporary piece of tape. Just tape the nose really quick, because we want to check placement before we tape this thing in permanently. So just tape that down really fast. I'm going to go ahead and get my baster, open this up, insert it there, withdraw some of the contents from the stomach, go ahead and close that back up there. So the color of it looks good, but we're going to take it over here, so if you want to come take a peek. We've got our tester strip. I don't drop it on the ground.
No, it's not your fault.
Rip one of these off here. Take it, squirt it on there, and then we're going to compare it really fast to the color on here. Which looks like it's about a 5, so that's perfect. You want to be right around there. That indicates that we're actually in the stomach. So go ahead and shut that. Go back over here. I'm going to go ahead and get my tape here now. I'm going to go ahead and, so we know we're in the stomach and the placement of it's perfect. So we're going to go ahead and remove this tape now without moving it around too much, because we don't want to irritate the patient's nostrils. Tape this on the patient's nose.
I mean, so you can see.
Go ahead and get one of these out of your way really quick. Go ahead and go.
This is really tacky. Like it's
Under.
on this.
Tape it around.
The tip of that does not look very good.
Take this
I
piece of
think
tape.
that would make it coil up. Whereas if it was really stiff,
Other one.
it's gonna go down. Alright.
Go around the nose. Make sure that there's no clumping of the tape. It looks pretty good. If there's clumping, then it's going to be dirty. So, perfect. How does that feel? Feel okay? Awesome. I'm going to go ahead and now go ahead and hook him up to the suction. So the way that we would get the suction going, you want to have it on low intermittent. So we're going to go ahead and turn the suction on. We've got our tube here. Put my finger on it and turn this on to continuous to begin with. I'm going to adjust it until we're in between, I know you can't really see this, but in between 45 and right around 65, 70. So it's on low, looks good. Go ahead and move it to off for a second until we get it hooked up. Go ahead and take this.
I'm like, oh my gosh, Leona's not gonna be able to get
Plug
this
it in there. And click it to intermittent. So now it's on low intermittent and it is suctioning. Awesome. So that is all that we're going to be doing for the moment. I'm going to go ahead and leave that on for a while. I'll be in and out checking on you for the next couple of minutes. Is there anything I can bring you at the moment? You've got your call light next to you. Anything I can do for you? No? Okay. Well, I'm going to go ahead and take my gloves off then. Wash my hands. And that's the end of the procedure.
The difference.